Good evening, everyone, and welcome to your Freedom Hub's presentation of the Free Market Cash Patient. I am your host, Jeff Cantor, along with my co-host, Charles Froman. We have some great sponsors we're going to talk about tonight, but before we get to that, let's talk for a quick second about the fact that these shows are all recorded. It makes for some great viewing over time. They are timeless, frankly. You've got some you can watch them from a year and a half ago. You think we recorded them yesterday. These are the channels that we're on: BitChute, Brighteon, and YouTube. These are case sensitive because they are bit.lys, so you'll want to kind of jot them down accordingly. And then before we get into that, let me just divert for a quick minute. We are sponsored by your Freedom Hub. And then, as I said, we are on all these channels. So here we are on Brighteon, and I want to kind of circle back to this. And here we are on BitChute, and here we are, and I want to show you my channel listing. Here we are on YouTube. But take a look at the very first video here. Removed, violated the community guidelines. So now, banning always has its been. Look at that, 242 views and 13 likes, no less, before they pulled it down over there. So we had up at Brighteon, and so we wanted to capitalize on that banning. So what we did here is, you'll check this out. It's banned. And then also this one too here, where we put a little commentary, and notice this video has been banned from YouTube. What an obnoxious company. I'm thinking that they pulled it down because the guy on the video says that Google's a horrible company. So we're thinking maybe they didn't like that. But here, check this. And they pushed it also up on BitChute. And over here now we're up to 534 views. So getting banned definitely has its advantages, no question about it. Ridiculous. But that's how they function. So, but if anything, and like with that doctor, see, he was pretty benign, but they showed their true colors to him. He suddenly had a negative attitude about that company after what they did to him. Prior, he could care less. He just thought they were benign like everybody else typically assumes. For a quick second, let's divert here. This is one of the killer sponsors we've got. This is the nation, probably the global's only bioactive hemp program product that's out there. It's got some key elements here, and we're definitely having the chance for our listeners and viewers to be able to get a discount of 15%, which is pretty substantial. Typically, it's like 10%, so we're doing a special promotion that we worked out with them. But I actually have a couple people on here that have actually had some actual results. And Amik, I know you did. Why don't you give us a quick rundown what happened to you with this program?
Sure. Can you hear me?
I can.
Okay, good. So I made a bad ski turn early in the season. I had really a bad lower right side back pain, and I started using the roll-on. And in the meantime, I had seen chiropractic, and it would improve it for a day and a half. It would come back, and then I started to roll on in literally, I would say within 10 days, it was totally gone and it hasn't come back. So that was huge because I hike and I snowshoe and it was bothering me all the time. I didn't stop doing things, but it definitely bothered me. So
that's good.
Yeah.
Perfect. Also, I see Veronica's here. I know she's had some successes too. What's been your situation?
Hey, Jeff, this stuff has saved my life. That's just the easiest way to say it. I fractured my neck in 1990, had a couple of traumatic brain injuries, vagus nerve, autonomic nervous, a lot of stuff. And, putting this on, I realized a couple of months into it, my vertebrae used to move. I call them musical vertebrae. I realized about 2 months into it that my neck has not been needing to be adjusted at all for 2 months for the first time in 30 years. So it's just taken away a lot of the headaches. It just feels like my spine is stronger. I can count on it being stable. So, and nothing else worked. I've tried everything.
Yeah, and that's the reason why we were okay to have them as a sponsor, because that was the key. There's plenty of stuff in this category out there, but if it's functioning, and this is of everything we've been able to vet, the one that does the best in that regard. So I appreciate that. That was great.
Yeah.
And then lastly, just before we completely dig into today, we also are just teasing you a little bit because we're going to be doing some more stuff rolling out about the health program that we've got that's inside of this new Cash app, which is exactly where you would find someone like Jason here is a perfect example. We're about to completely change healthcare in a big way. It's down to you, me, the doctors, the consumers. Forget the government, anybody else. They're not here to help us. They're just there for themselves. So this is going to be a big alternative for all of us. So on that note, though, let's talk about today. Oop, let me get out of here one sec. I went to the wrong place. Here we go. Charles, why don't you do a little quick introduction for us here?
Sure, Jeff. And of course, we have to honor our sponsors who allow us to bring these national leaders in health disruption every week. And Forbes did feature us as the cash patient makers. And when you pay cash, your choices expand. And we push the envelope in our choice of speakers. And I'll have to say, Jeff, this title did get some pushback from some of our good friends, both allopath and naturopath, thinking we were trying to replace primary care. And that is not our goal with this title. We are trying to, get rid of the barriers to disruption and improvement. So sometimes the way people define certain categories like primary care is limiting to patients. People go to primary care doctors and chiropractors, and acupuncturists, and naturopaths separately. But a lot of folks have a misconception that a chiropractor is just to get an adjustment. And they are important for that. But as like any other health professional, they do have broad experience and knowledge. And so that's the purpose of tonight, is to broaden patients' idea of what first-line care should entail. It doesn't just have to be an allopath primary care physician. Chiropractic never will replace allopathic primary care, but it can complement it. And Justin Quail has been a chiropractor for almost a decade, and he's expanded his practice to treat children as well. And that is a growth area because a lot of parents aren't always pleased with how they're treated by pediatricians for a variety of reasons, sometimes dealing with a lack of respect for informed consent. So we're going to hear about the expanded idea of primary care from a chiropractor perspective. And so that is the preview, Jeff.
Very good. Had myself muted there. All right, Justin, I'm going to stop sharing. I'm going to give you control of the screen. So if you'll please regale us.
Awesome. Thank you so much. Let's see. Yeah, it's funny. If you guys knew me, actually, before I even dive into that, thank you guys so much for this opportunity to be here. I was watching that band video of my lunch today, and I got to say, like, I'm grateful that this information is getting out there and that people are willing to push the envelope. So thank you for that and for letting me be here. And it's funny, when I was talking about this topic, when I was asked to kind of speak to the nature of this, it's funny, so many people think this means that there's some sort of competition of some sort of goal to replace. And that is, if you knew me personally, that could not be further from the truth. The whole goal, I think, for primary care physician is to be able to identify what's going on and give the patient the best level of care possible. And that doesn't always mean it has to be in our offices, right? If there's someone that does something specifically, then and the patient is better off in their hands, and that's just what we need to do. So, but yeah, thanks again for letting me be on here, and let's just go right into it. I'm Dr. Justin Quail. I practice in Virginia Beach, Virginia. As y'all alluded to, I have a family-based cash practice. We've been practicing here for 5 years. And, my goal as a chiropractor is to I want to empower people to be able to make their own healthcare decisions. Essentially, like, I want the patient to be able to be more than just, I don't want health to be something that's done to them. I want them to know that they're an active participant. Like, this is their life. And I really want them to be empowered to make their own decisions. But as we talked about before the podcast started, as a chiropractor who runs a cash practice, I really want healthcare providers to question why they do what they do. I really want healthcare providers to think outside of the box when it comes to the way we take care of our people and the way we run our practices. So a couple points here. Let's see. You have to forgive me, I'm not the best at Zoom. Here we go. All right. We can't really talk about chiropractic as a primary care or as a first line of contact for health without really understanding the true goal of chiropractic. I know people on this group already have a great idea of what's going on. A couple of y'all already said you've been seeing chiropractors. So I know that's not tailored for everyone, but for the people that don't know what a chiropractor really does, here we can look at that for a moment. Chiropractic and pediatric or chiropractic care during pregnancy is something many healthcare providers just don't know about. So we definitely need to go there. We can talk about the differences between chiropractic and other modes of healthcare and why that gives us a good advantage of being able to see deeper into a patient's history. And also, I can't be on any sort of podcast without talking about cash practice and what that's done for me. And then, of course, we got questions at the end. So chiropractic started in 1895. We're not going to go through the whole history, I promise you. But it wouldn't be a chiropractic talk without talking about B.J. Palmer. He's the developer of chiropractic. And this is really the basis that all organs in your body are connected to the one under your hat. And to understand chiropractic and why people should see a chiropractor, you have to understand that what we're really dealing with here is the function of your nervous system. And when you look at the nerves, it's so easy to get referrals to our office, for example, that are all based in pain. The misconception about our profession is that what we fix is low back pain. Statistically, 80% of adults get low back pain over the course of their life. But when you look deeper into what we're really doing, we're affecting the way the nervous system works. Your nerves, again, I know you guys know, biology, but your nervous system, it doesn't just affect back pain. Your nervous system regulates every other system. One of my major goals as a chiropractor is to find the joints that aren't functioning appropriately because it affects the mechanoreceptors, it affects the proprioception, it affects how that joint interfaces with the rest of the nervous system. So when you have that joint that's not functioning properly for long enough, it starts sending, with the gate theory of pain, you have proprioception. And if you have decreased proprioception, you have increased pain or pain fibers. You have increased stimulation to those nociceptors. So when your nervous system starts firing the wrong way, you start getting these pain signals that just override everything else. With Wolfson-Davis's law, we know that the body adapts to whatever stress that it's under. So we have a joint that's not functioning properly. We know it's affecting the proprioceptors and mechanoreceptors in that area. Well, over time, if you have a joint that's not functioning the way it's supposed to, it's going to adapt. So this affects the hard tissue, the bone, as well as the soft tissue, the ligaments, the tendons, the nerves in that area. So if that's true for misalignments and for joints that aren't functioning properly, we can also assume it's the same when you get a joint to work better, right? If you can get that joint to start functioning the way it's supposed to, the body will adapt that way as well. And that's why there's also a misconception that what we do is we take crooked spines and make them straight. The real goal, in my opinion, is to get the nervous system to start functioning in a better way and for the biomechanics to start functioning more properly. That way the brain can get the information it truly needs. This is pretty fun. If you've been watching the news at all, there was a study a couple months back now, but they were saying that tech neck caused this horn that was growing in the back. And anyone who looks at radiology knows this is just calcification of a ligament. But to me, this is just proof that our lifestyle just beats us up. You know, we're not built to, I mean, look at the last couple of months. I'm sure anyone on this call, your patient base has been through an unprecedented amount of strange stress, whether that's being on a Zoom call, not just for a nightly call, but for work every single day, oftentimes 8 hours a day. Our bodies adapt to whatever we do. So it's funny, I was looking into this study more, and there's a group that called this out and said, hey, look, maybe it's not tech neck. We know that this calcification of the ligament happens with anterior head carriage. And I thought that was kind of funny because, like, look at this picture. I mean, how if you have any sort of kids in your practice, you've seen that in your waiting area, or you see the parents look up the moment you walk in the room. So, but when we continue to walk through what is the goal of chiropractic, you see you have a joint that's not functioning properly. It's not sending the signals it's supposed to. The body is now remodeling, it's adapting. And now you start to have compensation patterns where, I mean, again, I spend all day talking to patients, so I like to keep things at a very simple level, but I mean, we have two legs. If one hip's not working the way it's supposed to, there's only so many structures that are going to compensate for that. Compensation is kind of beautiful because really the body will start to adapt without you present. You don't have to try, whether it's a skiing accident, or whether it's just sitting behind a desk for your job, your body will start to use and really abuse different structures because of joint dysfunction. So what does all this really mean? If you have a patient that presents to your office with low back pain, for example, again, 80% of adults get it. Let's say there's a problem at L4, right? Base of the lower back. If we have an issue, L3, 4, 5, y'all know this, you know, that's what the sciatic nerve is made from. If you have dysfunction in this area, now you have a joint that's not firing properly, mixed signals to the brain. That's going to affect not just the spinal nerves in that area, but now it's going to start to affect the biomechanics of the whole pelvis. What does all that mean? That means if you have issues in this area, L4, for one patient, they're going to present with low back pain. The next one with sciatica down the left leg. The next one with sciatica on the right leg. The next one could have restless leg syndrome. Right now we have hypo or hyperfunction anywhere that nerve goes to, or the surrounding structures from compensation. What's all this getting at? That same patient comes into a chiropractor's office. We find that there's an issue at L4. We resolve that issue through a specific scientific chiropractic adjustment. And then that patient returns to their medical doctor and they say something like, hey, I saw my chiropractor and my restless leg syndrome went away. My sciatica went away. My bowel issues went away. We see tons of kids in our office. So moms will come in and say, hey, my child's colic went away. And this is where there's a lot of common misconceptions between our professions, is that people think what we're doing is treating this list of symptoms, right? And it would be easy for someone who does see results, if you have 100 patients that come in and 90 of them, their bowels start functioning in a better way because you affected the spinal nerves at L3, 4, 5, sacrum, that whole area, it would be easy to say, I treat those things, but we don't. We don't treat those things, right? What we do is by normalizing joint function and affecting the nervous system in that area, the body can start to work and heal in a better way. It can start working the way that it's supposed to. Wolff's Law and Davis's Law work both ways. If you have a joint that's been misaligned for a long period of time, if you've had long-standing dysfunction, and we've all seen these people that have had, you look at the intake paperwork and they've had these issues, not just for days or weeks, but years oftentimes. They've had chronic issues for years. You know, these patients, it takes a long time for the body to heal. You know, broken bone, what, 6 to 8 weeks, a ligament, 10 to 12 months. that doesn't mean someone has to see me for 10 to 12 months, but this is why most chiropractors recommend coming into the office 2-3 times a week for weeks or months, depending on, and there's studies to back that up, that it takes the body time to heal. One example I thought of for this, with all the quarantine stuff going on, we have people gaining weight, people drinking more, people stressed out more than ever, people hitting the gym less. And what does that translate to in our patients? We have these people that it's going to take them time to get to where they were before all these response measures were taken. It's going to take time. Like if I had a deconditioned patient in front of me and I said, hey, look, do 1 plank today and you'll have a 6-pack tomorrow. It just doesn't work that way. We know that in a good way, oftentimes, we know that it takes time for the body to change. And that's why chiropractors, it takes time and repetition to make that change. And again, most of you guys know this stuff, so I'm sorry to bore you with this, but this is why we make these types of recommendations. And you'll notice that all these things that I mentioned about joint dysfunction, about gait theory pain, about the body not functioning the way it's supposed to, at no point have I mentioned age. I like to joke with my patients and say, they did a study, babies and children have spines and nervous systems too. Realistically, when does trauma start? We see that labor is tough. I mean, I've got a 4-year-old, a 2-year-old, and a 2-month-old, and this may not be PC, but I'm grateful to be the dad, right? Like I saw what my wife went through, and I'm incredibly grateful that she was willing to go through labor with my amazing kids. But labor is tough on mom and baby, and this is the thing, is that if trauma really starts that young, right? If birth is a traumatic process, and if pregnancy is an inflammatory process to the body, we have to start looking at kids a lot less like they're these malleable things, and we have to look at them more like these are little people with their own little histories and their own biomechanical issues. Another thing too, if anyone here in this who's listening to this has kids, I mean, I have a 4-year-old. My son Braden is awesome. He's hilarious, but he's jumping off of everything. He's falling down. I mean, if you have a waiting area at all in your practice, that these kids are running up the walls. Even if they're good-mannered kids like my son, they're still doing crazy things. What causes these issues, this neuromusculoskeletal dysfunction, what causes this is stress. And to break that down even more, it's not even the stress, it's the body's inability to adapt to physical, chemical, or emotional stress. That's what causes these issues. So if you have labor, which is a traumatic process, you have a big brother picking up his little sister the wrong way and kicking and punching and all these things, in my opinion, it's almost foolish to think that we need to start looking at biomechanics when this person is 35 with great insurance. We need to start looking at the whole family. And what I've personally found is that one of the major barriers that most families have to care is either time or money, or no one told them that a chiropractor could actually help them. So because the nature of changing the body takes time and repetition, this is one of the reasons that I think it is important to have the conversation, where do chiropractors fit into healthcare? This is why I think there's a solid argument for chiropractors being a really great first point of contact for healthcare providers, for patients into the healthcare system, rather. Because even if you do the most thorough history and you have wonderful oswestry forms and you're looking through thoroughly at what's going on, and you really listen to the patient and ask great questions, there's things that you won't get in 1 or 2 or 3 or 4 or 5 sittings with a patient. You just, it's hard to gather all that information. Like I can tell you from personal experience, after knowing a patient for months and seeing them regularly, you start to really get a grasp of who is this human being in front of me and what is truly the stress that is causing these issues. Perfect example, if you have a person that digs ditch for a living, you have a person that got injured At work 10 years ago, you have a person whose marriage is falling apart. You have a person who's grossly overweight and very deconditioned. Each one of those people would benefit from a completely different healthcare plan if you're going to look at the whole thing. So again, when I was asked to speak on the role of a chiropractor as a primary care physician, at no point did I ever think like and I still to this day, I'm a chiropractor. That's what I am. That's what I do. But at no point do I want to replace any of those other integral parts of our healthcare system. It would be tragic if someone with a gunshot wound came into my office seeking care. Like that's outside of my wheelhouse, and that's something I truly don't want to do. I'm not trained in well enough to do that. So this though is why I think chiropractic makes a great choice for people to really start to get involved with their own health, because chiropractors all share a common belief that the body heals itself. And I would say in our office, and I know many other offices, we do a really good job of trying to teach people that that is the real goal here. So as far as chiropractic with cash practice, I think cash practice expands far beyond chiropractic. I think there's two things, 2 points I really want to make here. One, during COVID, we've all had to pivot. We've all had to make changes to our practice. We've had to change the way we do things, the way we interface with patients or new patients. Especially during this time, running a high overhead practice, having a fleet of people to do your billing, or to have, as a chiropractor, more 1 or 2 or 3 or 4 people that have to do all this insurance billing, running a lower overhead practice is beneficial for obvious reasons during a time like this. But I think it goes deeper. The benefits of running a cash practice, I think one of the biggest things that people overlook is just the freedom. You know, if I believe that someone needs to go see, if I look at that patient and I say, this person would really benefit from seeing this person over here, I don't have to jump through hoops. I don't have to think about what does their insurance cover. If I tell someone, hey, look, this is what you need to do, at no point do I have to worry about the steps in between. Perfect example is MRIs. So many people are forced to do different things before they can get the MRI, whereas in a cash world, we could truly recommend and say, that is the imaging you need right here, right now, without having to worry about whatever their policy says. I think as a healthcare provider, it gives us the freedom to do what we feel to be best for that patient based on the human being in front of us. And there's a benefit of that you can't really measure. In our practice, we have done zero marketing. Yeah, I see a raised hand here. I'm not sure how to do that. Let's see.
Well, go ahead, Justin, finish up.
Okay, cool. Yeah, and this is really short, but I think it's very powerful. You know, when you have a patient in front of you and you are able to make the recommendations that you feel are best and completely disregard the insurance system's say in that matter, you build a relationship based completely on honesty. A patient can, and I know everyone on this call, I'm sure, is making honest recommendations. It's not really what I'm getting at. When you tell someone, this is truly what I believe is best for you, and you don't in the back of your mind have to consider whatever coverage the person in front of you has, not only do you build a trust-based relationship almost immediately with that patient, but you also you instantly differentiate yourself with the entire market. There's, for example, I live in Hampton Roads, there's 200 chiropractors here, there's 3 cash practices. So being so honest, telling people, if you were family, this is what I would tell you to do. And they can feel that, they can sense that. So by having that relationship and starting there, you can really have a practice that kind of builds itself. Because in this time where we're all trying to make sense and do the best we can for the people in front of us, that honesty, that I truly care about you and this is what I feel is best, that is unfortunately somewhat uncommon. So if you're debating cash practice, you really have to question why you believe what you believe. And I really feel like it's an important step to ask why you're making the recommendations you do. Is it based on real science? Is it based on studies? Or is it based on the coverage that that person in front of you has? So that's, for me, that's really it in a nutshell. What were you gonna ask there?
No, that was quite good, and I'm going to say we're going to definitely have some hands popping up here. One of the questions I would ask you just out of the gate is, what made you decide to go into chiropractic? It's not like a high profile position. Most people think, I'm going to medical school, and typically I don't hear people say, I can't wait to become a chiropractor.
Right.
What made you decide that was the more appropriate place to be?
Yeah. So for me, and I think this happens a lot with patients that we see. I had this horrible upper back issue. Between my shoulder blades when I was a kid was just killing me. I'm talking 7, 8, 9, 10 out of 10 pain, just truly uncomfortable. And it was just chronic. I had it for years. So I saw my doc, and my pediatrician took care of me my whole childhood, essentially. They said, hey, look, we can take an x-ray. They took an x-ray. It was negative. They didn't find anything. He referred me to physical therapy. I felt like no one was truly listening to what was going on, because here I am doing lat pull downs of 20 pounds when I was a pole vaulter at the time. I mean, I was like, no one was really looking at me as a person. I ended up telling my friend 2 years into this, I told my friend, hey, look, I have this horrible problem. They said, hey, you should see my mom. She's a chiropractor. I said, maybe you didn't hear me. Like I have like an upper back, like shoulder problem. It's not like a spine thing. Within 2 months of care, my shoulder problem went away. But more importantly, these nerves affect the organs in that area. I had horrible asthma as a kid. And I'm talking nebulizer, inhaler, singular Zyrtec. Like I just had major respiratory issues. Within 2 months, all of these things went away. And I just thought, what the heck? Like, how did no one ever tell me about this? So that's what turned me on to chiropractic. And really continuing on that, that's kind of why I'm here now, is I just feel like there's kind of a gap in our healthcare system for these types of issues. So that's what drove me this direction, and that's why I'm here today.
No, that's really good. I mean, Charles and I talk about that all the time, is that the consumer of today in healthcare really wants everything. And if you think about it, that's what they're getting when it comes to everything else. If I'm going to go out to eat, let's see, is it going to be Mexican, Chinese, this, that, whatever? You get all the choices. But when you come to medicine, oh no, this is it. This is the only way it goes. And yet, as you know, there's a ton of options out there.
Right.
Conveniently, we've got a lot of people that have been to chiropractors or currently go. So I'm keen to see some feedback. Let's start out. We've got Charles with his hand up, so let him get in here right away.
Thanks, Jeff, and thanks, Justin. That was fantastic. I got a couple questions, and maybe I can ask them one at a time. What does the Quail family consider for your first line care? Kind of give us that broad perspective of primary care. And maybe one of the unsaid goals of this webinar is to expand the definition of primary care, because I don't think you implied or said you want to replace traditional primary care. They have their role, but there are naturopaths, there are chiropractors like you, there are allopaths, acupuncturists. What is your perfect world of the different types of first line care options?
Yeah. So I mean, for my kids, for my family, what we do is really simple. If you had a person in front of you, what would you want them to be? You would want them to be healthy. The prevention of disease, the promotion of health makes way more sense than the treatment of disease. So for us, we just try to do our research and look into things that improve our health, whether that's taking things preventatively to improve our immune system function. Personally, we do some sort of anti-inflammatory diet. I love David Seaman's book on the anti-inflammatory diet. So we look at diet, we look at exercise. We try to just be as healthy as we can in those areas. As far as people that we see regularly, we do see a pediatrician, obviously. We got young kids, but at the same time, medicine is, we always look at medicine like a tool. And I think a lot of chiropractors are known for demonizing medicine. It's an important tool in the tool bag, but that's not our go-to. Oftentimes, pain and symptoms of the body's check engine lights. So for us, we get checked by a chiropractor regularly, and we just live a healthy lifestyle. And we know medicine's there when we need it. My mom's a nurse. I come from a medical family. So, but that's why I think it's important to focus on prevention, and that's what we really do.
Excellent. Paul, I think you've got your hands up, and just by the way, Paul has just got a brand new documentary out called Diagnosing Healthcare. He's getting ready to go on a world tour, help present that to the world. So that's exciting. Go ahead. But Paul, why don't you ask your question, and maybe you can give us a 2-second update on the film too, actually.
Okay, yeah, sure. And thank you. Great presentation, by the way. Yeah, the film itself is doing very well, and we're hitting the film festival circuit. So going around the world, like Jeff said, to promote the movie and the ideas of the free market healthcare system as well. Yeah, so I'm waiting to hear right now from Venice, which is one of the top 3 festivals, and certainly give an update on that. Once I hear on that, be nice to go to Venice and do that. But the COVID situation's also concerning because travel right now and all that's kind of restricted. So we'll see. But back to a question that I had concerning chiropractic care. My population that I work with in the medical community is higher acuity, complex care. Usually it's catastrophic and pretty high acuity patients. So my question would be, in terms of chiropractic care, are there any specific advantages or disadvantages concerning chiropractic care with that population?
Absolutely. So my internship initially was at the VA hospital in Dallas, Texas. I've worked with quite a few high-risk patients over the years. I would say that there's different techniques that are very useful for each population. One misconception with chiropractic is that we would use the same technique for each type of patient. Obviously, we would not do the same amount of force for each human being that's in front of us. But yeah, I think supporting the nervous system improves immune system function, supporting the nervous system every way that you can. Things that we see now, there's so much cutting edge research in chiropractic right now. It's very exciting looking at the upper cervical area as it relates to brain function. There's some really promising studies coming out, kind of explaining why we do what we do and the effect that it has on the neurology. So I would say that's one thing that we are missing as a whole in the treatment of these patients with more serious illnesses, is that they just don't have access to chiropractic care. I've even had patients, right now I'm taking care of 2 patients with stage 4 cancer. Oftentimes I'll have their providers reach out and say like, hey, is what you're doing, is a technique you're using safe? And activator technique is one of the different techniques I'm certified in. An activator is a technique that's all about using a light, force, gentle approach to chiropractic. It's safe for babies. The tool that's used has been studied for people with osteopenia, severe bone conditions. So yeah, there's definitely a place for that. And I think it's a huge benefit to the patient to be able to improve the nervous system function.
That's great. I appreciate that.
Thank you.
Okay, let's see. I think we had a question pop in here in the chat window. Let's take a look real fast and see what we got going here. A little separate side question there. So let's open this up a little bit. I know some people that are on here have been to chiropractors. Maybe we can get some experiences from them and just kind of why they opted to go that route.
I see a question, Jeff.
Yeah, you have one yourself at the moment?
I see Jane Dillon with a hand up.
Okay, go ahead, Jane. Are you there?
Yes, I am. Can you hear me?
I can. Go for it.
Great. Yeah, thank you so much for such a great presentation tonight. I work within bioregulatory medicine, which is really based on the science of self-healing, that if the body is supported correctly, it will self-regulate and self-heal. But I'm kind of curious, what is your perspective on COVID?
Oh, man. So, I mean, personally, I feel like there's never been a better time to emphasize the benefits of prevention, right? We see that COVID has such detrimental effects with people with pre-existing conditions. And unfortunately, our system and really America's approach to health is so reactive. It makes so much more sense to be proactive and preventive with these things, whether that's, doing everything really we can to get the body to function at a higher level. So as it relates to COVID, it's a little tricky. If we were to talk about this a year ago, non-COVID, and you said, hey, there's a patient and it's your kid, it's your friend, it's your sister, and they have this issue, they're having a high fever, they're having these things, would you mind checking them out? Would you please come adjust them? Most chiropractors that think the way that I do would be there in a heartbeat. Why wouldn't you? Now with COVID, it's interesting, some of the limitations we have as chiropractors. It's not that we can't, be around those patients and help them, but with all the quarantining and things around it, it's been a little bit difficult. So, but I would just say COVID kind of illuminates the holes in our healthcare system when it comes to promoting health. And I think it's important that we start looking at those and taking a broader approach than just being so reactive. Does that kind of answer your question?
Yes, thank you so much. That was a great answer.
One thing I would add to what you just commented is the fact that now with COVID, certain things that have been in place, like cross-state licensure and things, are getting waived. So that's going to potentially allow some things to kind of open up in ways we've not had the chance before, too. So as negative as this is, it could potentially bring some good positives out of it.
Absolutely.
You know what I do know, and Veronica, I'm going to see if you're online still. Can I tap you? Because I know you've had some chiropractic experiences.
Yep, can you hear me?
I can.
Oh, awesome. I'm plugging in. I'm down to like 10% now. My phone drops fast. Which part of them would you like to know about?
No, just, you found your way to going to chiropractors in the end. What it kind of was in your life story? How did you decide that chiropractic was the way to go as opposed to a typical primary care physician?
The way, when you're building a high rise and you have all the steel beams, that go in, that everything else is then layered upon.
Right.
I've always likened the skeleton to those steel beams. And if the skeleton is off, the air conditioning, the water, the plumbing in these high rises,
sure.
If those beams are off, and it never made sense to me. I've been an NCAA gymnast. I started at 4. I would always self-heal, do all kinds of different, I would listen to my body, which brought me into my path, which is a whole different path. But the chiropractics, when I first fractured my neck in 1990, I went to neurosurgeons, orthopedics. I went to all the different people that you're supposed to in the allopathic, and all I saw were glazed eyes. I'm like, okay, you're not like Dr. Justin was just saying, they weren't listening. I'm like, I'm telling you what's going on. And these other things that they were proposing didn't work. And then I lost my insurance. So this is a whole other part of the, cash only or cash ability to pay as an option. They wouldn't accept me as a client, even if I could pay, because it was cash. And all this stuff was going on. And finally, I found someone who is a chiropractor. And just like that, my brain was functioning, because it would go out pretty severely. I'd be in bed. I went from being the dynamo, to being debilitated in bed for weeks and months at a time. Quite a whole long thing. But so the chiropractics, it's like you take care of the core stuff first, and the other systems, it's like a tuning fork. They know how to retune to the core system. So that's, I'm all for chiropractics as the first line. Do the herbs, do the different things along the way to stay healthy. But when something wonky happens, like an accident or something like that, you've got to get the skeleton back in place, and the ligaments and the like all that, and the fascia. So yeah, it saved my life. I know that had I not had good chiropractic care, my systems would have broken down, and I would have eventually gotten to a point of no return. So I'm a believer.
Fantastic. I hear that sort of stuff all the time in that regard. What kind of came out of what you just said, though, Justin, was the idea of, paying cash and the rest of this stuff. So in today's world, see, all these other existing doctors are so acclimated to only taking insurance. And since chiropractic historically has not taken insurance in most instances, you've been understanding that what you're actually in is a business. A lot of doctors don't realize, you actually have a business over there, Doc. It's not like you're just some arm's length attachment to Blue Cross.
Right.
What do you think is the advantage that you've got having been a cash pay patient as the world is now shifting in that direction compared to other doctors that are too tied to insurance?
Yeah, I mean, kind of first off, piggybacking off what Veronica said there, I've heard that story and versions of it so many times. And it's hard because what happens is, because I would say many primary care physicians, many neurologists, orthopedics don't really have a good relationship with chiropractor in their area or a real understanding of what we do. It's sad because what happens is these patients come in with these conditions where they're just out of sorts. They have this long list of issues, and it's to the point where they've lost a good chunk of who they are as a person. It's wonderful to hear these miracle stories over and over, but I always think, what would have happened if this wasn't the last wave of defense, if this wasn't Last Chance Saloon, but instead this was something that said, oh my goodness, you obviously have an issue in this area. Why aren't you seeing a chiropractor preventatively? So there's that. And then as far as cash goes, that's the second half of really that story, is that because the insurance has dictated the care for so many human beings that come into our practices, people are really limited in their choice options. Even though we live with one of the best healthcare systems in the world, with some of the best tools at our disposal, unfortunately, insurance kind of ties our hands behind our back sometimes. So what's the benefit for the doctor? Even though people may question your choice to go to a cash practice model, I really think that once you do it, once you lead the way, you end up with this undeniable amount of freedom where you can truly just help people, and you can get back to what, taking care of people was really about, which is serving the person in front of you the best way you can, giving them the best care, loving on them. I think insurance, it's a game to some people, but to me, it's not a game. It's not the insurance game. It's really, to me at this point, I'm pretty indoctrinated in being a cash practice at this point, but I almost feel like it's a compromise in our values. Just to see, no one on this call, I'm sure, is excited to do more paperwork to justify their care when they know they're honestly doing that for the good of the person in front of them. So I think there's a lot of benefits. But freedom is one of the biggest ones.
Well, that's a real obvious one. But the other part of it too is the fact that, if you've got somebody like insurance or whatever, let's just say you've got, like they say, would you put something on Facebook that you would be embarrassed if your mom read it? So it's almost like having insurance. If they're in the office with you, even if they're not physically there, are you sort of like skewing or holding back a little just because you sort of know that they're kind of overseeing you a little bit, so you tend to lay back a touch, even if it's just a tiniest bit, how bad that really is.
Right.
But then the fact that the other question I would ask you, though, and then we got time for one last one with Charles here because we're running out of time quick and this has been so good. As a consequence of you being cash, and having all those other chiropractors, because at least now, you can't really compare yourself in some respects to allopathic, because I guess we could say it's apples and oranges. But if you're a chiropractor and there's another one, and I appreciate there's a lot of difference between them, but to the consumer, if it just says chiropractor after your name, then they're all the same.
Right.
And you've got hundreds against you. Do you feel pressure on what you charge, or does that not matter what you're able to charge in the cash world? Like where everybody in allopathic, Medicare says we pay X, so every doctor's getting X. You can be in a place where everyone's getting a different price. Do the other competitors to you force you to adjust your pricing, or how does that function?
I would say to that point, absolutely not. because what we're offering is something that's completely different. People know when they walk in the door. If anyone's looking at an EOB, explanation of benefits, you can just see, like, this is what we say it's worth, and this is what insurance says it's worth. I get to determine as the provider, this is what my time is worth, and this is what we do. You know, as a chiropractor who stays very much in his own lane, you know, I view chiropractors as doing only chiropractic. It allows me the freedom to set my own fee schedule. So truly, not only do I not care what people around me are getting paid by Blue Cross Blue Shield, for example, not only do I not have to care about that at all, but every single adjustment that I do, every single patient that walks in the door, that is a contract between me and them directly. So I'm able to set a fee schedule that allows me to have that freedom to make choices, that freedom to provide for my family. So I would say no, not at all. The secondary benefit is not only do I not have to care about what the people around me are charging, inadvertently, because it makes us instantly different than our market, it's driving so many new patients to our office. It has made our practice explode in a way that I did not expect at all, especially with all the negative feedback. When I was told I was starting a chiropractic office, I cannot emphasize enough how many colleagues I respect told me it's just not possible. I mean,
because it was too scary for them to hear you making that move, because then they suddenly had to justify staying put, or them suddenly having to make that move, and everyone's scared to move.
I mean,
so you moving is not a good thing.
Years later, I've gone and I've talked to people about cash practice, and they've literally said, you cannot do that. It doesn't work. And I'll say, hey, look, I love you, but I've been doing it this way for 4 or 5 years now. Like it's working. Like this isn't a theory. Like this is practice experience at this point. So it's something being a proponent of cash practice.
And what we like about it is it does create the variety of pricing, because if Medicare is like one price for all, then how do I differentiate doctors? If one's really, really good and one's mediocre, then one could command a higher price, and suddenly we start to figure out what this value of all these services really are. And like you said, we've got the best healthcare in the world. It's just how we're paying for all of it that's a mess. I see we got time for one last question. David, I've got your hand up there.
Justin, your contracts with individual patients, are they individualized? Let's say you have a patient that comes in who just got laid off. How do you handle that in terms of the Hippocratic Oath?
Sure. So in the state of Virginia, we do have room to practice in a way where if someone has a financial issue, we can meet them where they are. You're supposed to have a set fee schedule per our state laws. However, in our office, I've had people that come in that truly cannot afford care. I've got, moms going through divorces that take care of multiple kids. I have people that, have lost their jobs, especially, I'm sure we've all experienced the hardship over the last six weeks, 8 weeks, 2, 3, 4 months now of people losing their jobs left and right. So the short answer to that is, I just meet patients where they are. And, I just ask them to tell us what they can truly afford. And that's what we do. Serving people is my number one priority, and loving on them the way I'm supposed to is my number one priority. So I think I'd be doing them a major disservice if I couldn't meet them where they are.
And that's a fantastic response, because really that's what the luxury of being a good doctor is, that you can make those decisions. I've talked to doctors when the conventional insurance will, well, we only can do 2 Medicaid people and 2 of this, because otherwise we'd lose our shirt at this joint. And you have the latitude to make money where you're able for the people that can afford it. And again, if they're using you, it's going to be a lot cheaper in a lot of instances than if they're having to go the other route where they got to pay a fortune in premium and so on, which is where we come in. So I really thank you for being here today. This was really great. Let's just kind of close it out a little bit. Let's talk for a quick minute, because this totally fits up what you're talking about, is kind of where we sit. And this is yet a different little sponsor we got on board. But the idea is, how do we stay preventative? Because, one guy said, the goal of allopathic medicine is to micromanage my demise. I don't want you to die too fast. I'm not looking to cure you, but I want to kind of delay the inevitable. And we're going to make a bunch of money because, like the one guy that we got banned, he said, well, I think probably why he got banned is his total COVID cure is $20. He goes, who's going to make money at $20 at the Cleveland Clinic or whatever? There's just no way. So, but this is another fantastic situation. We've got a great doctor here where you can actually get a free consultation through the first of this next coming month. Normally it's almost $250. And this is a little special code we've got. But I know I got somebody also that had been engaged with this too. So hold on a second here. I think I have Lisa. Are you hiding out there, Lisa?
Hello, hi.
Hello there. Hi. Why don't you give us a little rundown? Because again, like we said before, we're looking for the best of the best. How did you come to find out about this product in this organization? What has it done for you?
Well, I started taking the nutrition products about 2 years ago, and I've taken several of them. I'm a person that I don't really like to take antibiotics or anything, not put a bandage on it, but rather I like to go ahead and do natural as best as I can and try to cure as best as I can. And one of the, several products I've used, one is the CBD powder. This was amazing. Ever since I was younger, my shoulders would hunch over, and my mother used to always say, stand up straight, Lisa, stand up straight. But I never could. And after I started taking the CBD powder, within about 4 to 5 days, my shoulders were literally straight up and down. I was standing perfectly erect. So that was amazing with the CBD powder. Like I said, it only took 4 or 5 days. And another product I love is the energy pills. I love this because it's like an all-day energy. You know how some of the energy drinks and stuff will give you a quick high and then back down you go, you crash. With this energy pill, within like 15 to 20 minutes, you feel no longer tired and it lasts all day long. So that's a really, really wonderful product I love.
Fantastic.
Thank you. Another product that I really like is it's called the anxiety spray. This is perfect because with stress and so much anxiety, with just a couple little sprays, within 20 seconds, I feel a total calmness and literally my eyes start seeing, the vision is completely clear. So that's another wonderful product. I love these products. I just absolutely love them. And I love the part that they're natural. That's, something that's fantastic. They, nutritional has the lozengers, and I get pneumonia quite often. I've had it approximately 6 or 7 times. I've been in the hospital for it. And about 2 years ago, I felt that I was getting pneumonia again, started getting the symptoms. So the lozengers, I took 5 of them within about 2 days. My symptoms went away, and it's been 2 years since I've had pneumonia. I have not had it since I've taken those.
Fantastic. So that's great.
I really believe in them.
That's great. Appreciate that. That was really good. I'm limited on time, Lisa, but I really appreciate that. Was really very good. And again, we're just trying to find out some stuff that's valuable here that can help all. Let's do one last little quickie question. I know Charles had one last thing we wanted to pose to Justin before we zoomed out of here tonight.
Well, if we have time, one niche that Justin fills is chiropractic for kids, and I was curious how he got into that.
Yeah, we didn't talk about that for sure.
Yeah, and he must know parents displeased by some of the bullying in pediatricians' offices. So how has that part of this practice grown with the kids, if we have time?
Sure, yeah. Kind of how I went down that road. It started out, my vision was to take care of kids with basically neurological disorders that affected, that's my kids right here, kids with neurological disorders. I wanted to have affordable chiropractic care for these children with Down syndrome and ADHD and these issues that are getting more and more common, autism spectrum conditions. And what I realized when I started to look into taking care of these families is that the parents were so burnt out trying to get the care for the kids that they need. You start to look at and the whole family structure was just kind of breaking down. So that's what really got me into a family practice, was looking at the needs of the whole family. Especially working previously in a chiropractic practice devoted to insurance care, you start to see you'd recommend care for the whole family, but not everyone would start care. And the reason was because they couldn't afford to pay for each person. So that's why it started to make sense that the paradigm had to shift somewhere. So over time, there's a group, an organization called the International Pediatric Chiropractic Association. They give wonderful classes regarding pediatric care. So I got certified in a technique that helps balance the pelvis during pregnancy for pregnant moms, and took some coursework with them, and they're fantastic. You're taught some of that in chiropractic college, but that's, you want to be the best. So once we started seeing pregnant moms, they have babies, and you start seeing more and more kids, and our practice has kind of grown organically to that nature. Once the community finds there's a chiropractor that's affordable, accessible, and wants to see the whole family, I think that's just kind of the next kind of evolution for a cash practice, is to just be available to take care of the whole fam. So that's
makes the most sense conveniently to the consumer, because if I can bring my family to one place instead of going to half a dozen different places, how much better is that?
right.
Justin, that was fantastic. I so appreciate being here today. We're excited to see what's going to happen next, as we're kind of, you've been at this for a long time, but it's overnight. It's like being that band who's played at the Holiday Inn and now you have a hit record. It's 10 years in the making to be an overnight sensation. So in many respects, you're kind of there too. So thanks so much for today.
I appreciate that. Thank you so much. Thanks for having me.